This video is for all of you who'd like to understand a little bit more about disc degeneration, in particular disc hernia, okay, or protrusions, degenerations of the disc, the intervertebral disc. This is a problem that causes a lot of people anguish because by the time they get their diagnosis, they are often directed towards surgery or weeks and weeks of physio or some other rehab. Okay, now the idea of the video is to go over what a disc hernia is, what the causes are, and what your treatment options are as well. So let's talk about, for example, the disc hernia. What is it? Think of a car first and the wheels of a car. Let's imagine one wheel is misaligned. Imagine how the load on that particular tyre will increase with time. Okay, it's rubber. Obviously, if load increases on that, bit by bit, that will wear out. And with time, we're going to get a tyre that will actually have holes in it. So that's something quite similar that happens to our disc on a very simple level, obviously. Let's imagine our spine, okay? And in between each vertebra, we can see, if I turn it this way, we can see these discs. So these discs are like little shock absorbers, okay, that allow movement between each vertebra, but also allow a space here for these nerves that come out the side, and I'll show you this on this model. Allow space there for these nerves, okay? Those nerves there, the nerve roots, they transfer messages from the brain via the spinal cord and these nerve roots to every cell, organ and tissue in the body, okay? So you can imagine if there's a problem in the disc, that represents a huge problem for the way the brain can communicate with the rest of the body. That's why disc hernias, when they're really bad, when they're acute, cause a lot of pain. Because your brain doesn't know what's going on exactly. It does know that there's a threat to the nervous system and it doesn't want to affect that at any cost. So what it does, it tightens everything down. It causes an extreme amount of pain for a lot of people. And that pain could be a sciatic pain down the leg, could be numbness in the toes, pins and needles, burning in the toes and feet, down the side of the leg, in the calf, in the glute. Could be just a low back pain as well, okay? And generally, people come in leaning to one side to get away from the pressure of the nerve on the nerve root on the other side, okay? So the actual disc hernia is degeneration of the disc caused by a situation where there has been an uneven load on that disc for a considerable amount of time. So a lot of people think, oh, it's from a one-off fall. Okay, from my experience of 30 years of working with people, it's not from a one-off incident. It's usually due to an incident or many that leave the spine misaligned. So instead of having a spine like this, nice and aligned, we've got an incident, okay, a fall, we've got a certain sport. Let's say I'm a surfer, we've got the same leg back the whole time. If you're a tennis player, a golfer, that's unilateral, favoring one side more than the other, then we will set ourselves up in a lot of cases for asymmetry between one side and the other. Okay, muscle shortening one side can actually also affect that. Scoliosis, okay, any activity we do favoring one side more than the other. What's going on here is that considering that the disc is between, let's say, 70 and 80% water, when it's misaligned, it dehydrates, okay? And as it dehydrates, the fibers in the disc, I don't know if we're going to see this here, around the nucleus start to weaken. So, if we get this one, we can see here that this disc, the fibers are weakening around the nucleus. With time, if that's allowed to continue, we get a situation like this, where the nucleus actually migrates back, and if it doesn't pass the margin of the disc, that's a protrusion. If it does pass it to something like that, that's pretty drastic, this one, but that's a very large, considerable hernia, okay? Now, that's what a disc hernia is, a situation where part of the disc is herniated and migrated out. Now that can go in the direction of the nerve root, it can go back centrally to the spinal cord, can do both, okay? But what happens in these situations, because they're nerve situations and we need to know if there's a possible threat to communication, that'll be very painful. You can imagine if a disc migrated in a hernia fashion to any other area here that didn't have neurological tissue around it, we would know. The really important thing to understand and remember always is that this is a process. Just like the wear and tear of the tyre of a car, from the day that's misaligned after going over a big bump or hole, there's wear on that due to the increase in load. But it doesn't become symptomatic, okay? It's just going on for a very long time before we know about it. Maybe the car needs to vibrate, 10,000 kilometers after it was caused. Something similar happens here. That load increases for a very long time, and the disc hernia can be present for a very long time, and it just requires the straw that breaks the camel's back to call our attention to it via symptoms and the sciatic pain, everything else that I've just mentioned. Because those symptoms are quite severe, we want to get out of pain as fast as possible. And what I'd say, this is the situation where you really have to stop and think about what's going on and consider whether your case is surgical or not. Consider whether you're going to follow a program to identify the causes, okay, to deal with the inflammation around the nerve root via medication, for example, via ice, via moving, decompress the disc via chiropractic, or if you work with a good physio or osteo, they can also help work the muscles to decompress it. But be prepared for a process. It's not going to be one day to the next. So if that's something that you don't want to deal with, also accept that surgery may not be your answer, even though the surgery might be successful. If you haven't gone and looked at the underlying causes, well, of course, the dysfunction occurring in your spine is going to continue. So there's a lot you need to inform yourself of right now. Okay, so what causes it? I've touched upon a few of them, but let's consider that we have more than 2,000 falls when we're learning to walk in the first 5 years of life. Each one of those falls can leave a misalignment, let's say, or a dysfunction at the segmental level of our spine. It only takes one segment. And this is actually what usually happens, because when people like myself are looking at MRIs, we won't see that every disc is degenerated. We'll actually see one or two in the lumbar spine. The rest are perfect. They're hydrated. They're healthy. So we know that for some reason function has been lost there over a long period of time, and it hasn't been decompressed, or in other words, it hasn't been allowed for that water to stop hydrating. Okay, so that's really important. Let's look at the simple things like the mattresses we sleep on. If we're sleeping 6 to 8 hours a night on a mattress that's too soft, well, that's plenty of time to compromise spinal function, okay? Tighten tissues around the segment that have you, when you wake up, walking and moving in a manner that's asymmetrical between one side and the other. Let's talk about also now people who might be carrying too many kilos, they might be obese or overweight, they might be sitting for too long during the day, they might be just doing things that our spine was never meant or never intentioned to be doing or subject to. All of these things are really important, because I would say at this moment, you need to look at the causes. Even if you do surgery, on the other side of that surgery, you don't want to be back in the same situation. This is your golden opportunity via pain and unpleasant symptoms to actually look for the cause, okay? And there are multiple causes. Okay, while I'm talking about this, I'll plug my book, The Secret of the Healthy Spine. In that, I've documented 30 years of my career and the causes that I came across of every back problem that I had contact with. Okay, so this is really important. But there's no lack of information out there. But there's nothing like also relating your life and what causes pain during those years along the way to make you think, okay, you know what? That might have been too good for me. A lot of us have childhoods and those teenage years that are, we're really active and we do a lot of impact sports. But just like the wheel of the car, if we're not correcting that at the time or don't come back later on to correct and realign that wheel or restore, okay, function back to the spine, well, of course we can't expect that disc won't have that pressure on that. Okay, like any pathological process, this can continue for years without us knowing, obviously via symptoms that are going to stop us in our tracks, or at least warn us that there's an underlying problem. Okay, so a lot of the causes that we don't often consider are things like smoking. Smoking reduces blood supply to muscles and the discs. Okay, Dehydration, okay, a lot of us don't drink enough water. Okay, our diet, is it inflammatory or not? If it's inflammatory, it's going to exacerbate inflammation that might already be occurring at that level of the vertebra and the nerve root. Okay, how's your sleep? Maybe it's not good. Maybe stress levels are high. Cortisol, when it's elevated, turns out to be, or I guess its role has gone from an anti-inflammatory role to a pro-inflammatory role when it's chronically elevated. So if you're under chronic stress, think about that as well. Will those last causes be enough to cause a discomfort? Probably not. But what you need to do is look at all of them and see their role in your life and how that could be contributing to that. All right, now you've been diagnosed with a disc hernia via an MRI, preferably an MRI, okay, magnetic resonance over a tomography, a CT scan, because it shows more. It'll show the relationship of the spinal cord and the nerve roots with the disc and the migration of the disc, okay? CT scans, in Australia at least, in some other countries, they're Medicare funded. A lot of people only get that, but unfortunately the detail they show for disc problems is not that great. So if we get that diagnosis, we've got choices. Okay? Most times that diagnosis is going to be made by an orthopedic surgeon or a GP. Your choice right now is to quite possibly consult with other specialists, people who've dealt with this in a way that's avoided surgery. And if surgery is mentioned, please consult 2 or 3 other specialists before you do that. Okay, I've had spinal surgery, and I'll say, ironically, after having my specialty in my career, helping thousands of people avoid surgery, ironically, my case is surgical. There's no way out of it. So thank God it exists in those times. But from my experience also of helping other people that thought they had to have surgery, most of the time was us sitting down having a chat about the cause. And I remember numerous times that someone had done everything. They'd done chiro, they'd done sessions and sessions of physio, they'd taken medication. The doctor often did not want to operate, but just thought, well, what else is there to do? We don't have any other options. And we've just chatted about the causes and said, okay, when's it worse, for example? It's worse in the morning. Oh, how's your bed? How's your mattress? It's really soft. Do you wake up with pain? Yes, I do. Can you sleep tonight on the ground and, put some blankets down? We'll see how you wake up. Guess what? So many times someone would wake up and say, I'm out of pain. So we helped avoid surgery that way. Okay, so I'm not saying that that's the case for everybody. I'm just saying that we need to look deeper. Okay, and if we get that diagnosis of surgery, it doesn't necessarily mean that that's always surgical. Okay, work with someone who's helped others avoid surgery if you don't want to do surgery. Okay, now if we're looking at what each profession offers, let's get this segment here. If we're working with a good chiropractor, and a chiropractor can manage, okay, to restore function and therefore decompress the disc via chiropractic adjustments, great. Now a lot of people say, well, that's dangerous. That will damage the disc even more, and it might even put pressure on the neurological system there. Of course it won't, because the articulations don't allow, there's only 7 to 11 degrees of movement there. That rotation doesn't allow for any damage on the disc. Okay, so be really aware of this. Okay, the information we get is very important, because we're going to follow a treatment path for a month or 2 months. We need to be really well informed by the right people. So what I do is I often combine chiropractic with physio and osteopathic techniques, electroacupuncture when it's in that acute stage. Almost always when someone's in the acute stage, I recommend that they start taking or continue taking anti-inflammatories, because we want to lower the inflammation around the nerve root. Okay, I want them walking. A lot of the time we've got to recognize also that this is a segment that's lacked movement. So as we restore function to the segment, we want the person walking. We want them moving. If they say, I can only walk half an hour and then the pain starts, that's okay. Let's work with that. Tomorrow a little bit more. I hope you can see this is a process that we go step by step. A little bit like braces work on the teeth. Okay, they aren't put on the teeth and have their effect done in, let's say, a week. Of course not. We live for a month, tighten it, go again, do it again. So this is the same sort of process. And initially what you'll find is a professional like myself will have the majority of the responsibility. And then with time, already after the first couple of weeks, that responsibility is passed to the client or the patient to walk more, change the mattress, sit, if that's the case, if they've got a soft mattress, sit less if they're working, stand up more, change their desk to a stand-up desk, hey, get a treadmill if they've got to. Just do what they've got to do to maximize the movement and function being restored by the practitioner. Okay, can you see what's going on there? Practitioner's still continuing, but the responsibility goes a lot more towards the client. Now, what about comparative studies? Okay, if I think of comparative studies, I haven't had many people in my career that have come with an MRI with a very obvious disc degeneration occurring and also get a comparative one when they're better. Most people who improve from disc hernia won't go back and do a comparative, but I do have comparative MRIs throughout my career that have shown from the same lab that disc has disappeared. And a lot of surgeons will be noticing this as well. They do recognize that your body has that ability. Your chiro, your physio, your doctor, they're not doing the magic. Your body is doing the magic. It's just that you've got to give it the conditions to be able to do that and heal itself. But if you keep this in mind, the importance of decompressing the disc, keep moving and avoid the original causes, you've got the best chance of allowing your body to repair that. Okay? Now, I would strongly recommend you do that. Always look for the causes, because you have to imagine how your future looks and all the things you love doing in life if you don't finally go to the cause of the problem. Even if you do surgery, the causes still will be there. You will need to look at those. Otherwise, you will be back in the same situation within 5 years. Statistics and studies show that. They call it failed back surgery syndrome. 70% of people in the first 5 years will go back with the same pain and a lot to have surgery again. Was the surgery a failure? I don't think so. I think the failure is us as clients and patients not looking to the cause and rectifying the cause. There's a lot of information to pass on to you guys, but I hope this video has helped. As I said, check my book out, The Secret of the Healthy Spine, or my spinal course, okay, Back in Action. There's 30 years of theory in the videos that I've presented there and the other coursework, okay? We have to learn how to care for our own spine instead of throwing that out to someone else, subcontracting that work. It's not a work for someone else to do. They're there in crisis and they're there to advise us along the way, but it's really us. We need to look after our health and our body today if we want to continue to do the stuff that we love today and tomorrow. All the best.